Welcome. My name is Dr. Mario Leyba. I'm a general and robotic surgeon here in Albuquerque, New Mexico. We're going to discuss several things today, specifically regarding patients, how to care for them in surgical wise, and how to make you feel more comfortable. I'm going to see you in my clinic. We're going to talk about things, but today we're going to give you some information so you can process, so when I see you later, we can have a good discussion. The reason for making these videos was to help the surgical process along. I've seen it from a surgical standpoint. I know how to do the surgery, I've seen it in clinic and so forth, but I've never really dealt with being a patient. And when patients come to my clinic, oftentimes they're overwhelmed with the amount of knowledge that I give them and other doctors, and they focus on that rather than listening to what's actually going on. So when they go home, their family members ask them, well, what happened? A lot of times they're like, I don't remember anything. So the reason for this is to help educate patients and family members and even providers and other people that want to be involved in the surgical procedures themselves. I treat surgical thyroid or parathyroid problems including thyroid cancer, thyroid nodules, parathyroid adenomas, and hyperplasia, goiters, hyperthyroidism, and hypothyroidism. What are the symptoms of thyroid disease? Symptoms depend on the problem, but may include a neck mass or swelling, difficulty swallowing, cold or heat intolerance, weight loss or weight gain, abnormal labs such as calcium, or thyroid stimulating hormone. How is thyroid and parathyroid disease diagnosed? Thyroid disease is common and can affect both men and women. A neck ultrasound is used to diagnose thyroid and parathyroid problems. Blood tests looking for TSH or calcium levels are also obtained. Usually your primary care provider or endocrinologist initiates the workup and refers to a surgeon for surgery. How is thyroid disease treated? Thyroid cancer needs thyroidectomy or thyroid removal. Thyroid nodules are evaluated with biopsy first, then surgery if indicated. Parathyroid adenomas usually require surgery. Goiters may require surgery if symptomatic. Hypo or hyperthyroidism are usually treated with medicine. How is thyroid surgery and parathyroid surgery done? In thyroid surgery, a small neck incision is made. Depending on the disease process, either half your thyroid, most of your thyroid, or the entire thyroid is removed. This shows a thyroid nodule on the right side. This shows a goiter which can affect the entire thyroid and enlarge it. This is a picture that shows your thyroid and the various structures on the neck. During surgery, we protect your recurrent laryngeal nerve, which innervates the larynx or the voice box. In addition, we preserve the parathyroid glands, which are on the back side of the thyroid, located here, 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 and here. Typically, you have 4 parathyroids. The function of the thyroid is to make thyroid hormone. Thyroid hormone regulates your metabolism and affects all the tissues in the body. After your surgery, if your thyroid has been completely removed, you may need supplemental thyroid medication. The thyroid is removed in a total thyroidectomy. A parathyroid is removed for a parathyroidectomy. Usually, an overnight stay is required to monitor for bleeding and calcium levels. Supplemental thyroid medication may be required for life. What are the risks of surgery? All surgeries have some degree of risk, but surgical risks include, but not limited to, bleeding, hematoma, infection, temporarily low calcium levels requiring replacement, nerve injury to the recurrent laryngeal nerve causing hoarse voice or airway blockage, injury to the surrounding structures, and need for further surgery or treatment depending on the disease. These complications are rare and are treatable in most cases.